Hello and welcome to my YouTube channel. I'm the public health doctor, and today I'm going to be answering a question that I get asked a lot, which is, what exactly is public health? So for obvious reasons, because of this global pandemic that has taken over our entire lives, public health as a specialty has gotten a lot more attention, a lot more time in the limelight than it usually does. And this means that when I tell people I'm a public health doctor, there's more recognition as to what my job might involve than there was before the pandemic. But there is still always a little bit of confusion as to exactly what public health is. So in this video, I'm going to be explaining what public health is, what the main branches are, and how it differs from clinical medicine. So starting off with, what is public health? Public health is a medical specialty, is a branch of medicine that focuses on the health of the population as a whole. So much like a pediatrician looks after children and a cardiologist looks after the heart, a public health specialist really is focused on the health of the population as a whole. Now, how we achieve this is different from how a cardiologist or a pediatrician might do that, in that they might have a patient come in and they ask them what symptoms they're experiencing, examine them and treat whatever illness that patient has. Whereas in public health, we actually take a step back. We think about what the factors are that affect people's health and we target those factors instead. This is essentially the basis of public health because we acknowledge that people can become unwell for a number of reasons, ranging from your individual genetics and your biological makeup, but also things like lifestyle, quality of the life that you live, quality of the housing that you live in, the quality of your air and the food that you have access to, things like that. And we call these external factors the wider determinants of health, or the social determinants of health. Means the same thing. So what we do in public health is that we focus on these wider determinants of health with the aim of making sure that as many people live healthy lives for as long as possible. That's a really broad aim, I know. So how do we do this? So we have three main branches of public health which sort of address the wider determinants at slightly different angles. We have health protection, health promotion, and health prevention. I'm going to be explaining these in turn. So starting off with health protection. This is the branch of public health that's a little bit more reactive. I say a little bit more, it's the most reactive branch of public health, in that it protects the population from any immediate threats to health. And these can be threats that are biological, like a virus, for example, like COVID-19, or things that are like a chemical hazard or environmental hazard. And really what the health protection team do is they look at, just for example focusing on biological hazards, they look at the levels of a disease and monitor what the levels are, and they investigate any outbreaks and try and contain those outbreaks so that as few people get unwell as possible. So this is the branch that people will be more aware of because of coronavirus. We then have health promotion, I think I said was the second one. So health promotion is the branch of public health that really focuses on encouraging people to make choices that are better for their health. So that's things like eating less sugar, eating less salt, more exercise, more breaks from social media, less smoking or no smoking would be preferable, and things like that. And the aim of this again is that by making these decisions, people are living healthier lives and living for longer. We then have health prevention, which I'm sure you can guess from the name is the branch of public health that focuses on preventing ill health. The most famous health prevention intervention that you will know of is vaccinations, where you administer vaccines to people so they don't get unwell with that disease, or if they do get unwell, they get a very mild version of that disease. But also things like screening programs for cancers and for other diseases, those are also health prevention programs, because whilst we can't prevent all cancers, we can pick it up as early as possible so that people have as mild a version of cancer as they possibly can, because if you pick up early, they get treated early, they have a better chance of getting a better outcome. So these are the three main branches: health promotion, health protection, health prevention. And I know I've described them as three distinct branches, and they are in some ways, but they do work together and intersect to all eventually have the ultimate aim of promoting and ensuring the health of the population is as best as it possibly can be. So for example, in health prevention, we have screening programs and we can pick up cancers as early as possible. But in health promotion, we encourage healthier lifestyles, more exercise, less alcohol, less smoking, and these health promotion strategies have been proven to reduce incidence of cancer in the first place. So those two will then work together, because if you have less cancers in the first place and you're picking up anyone that does have cancer early, the ultimate aim is that less people get cancer, but of those who do, we're picking them up as early as possible. So that's just an example of how the different sectors of public health work together. Now, how is this different from clinical medicine? And I'm sure you can already guess, we're not seeing patients one-to-one. We don't see patients and examine them and diagnose them, but we're working at that higher level, trying to affect and target those wider determinants of health. This also means that, as opposed to clinical medicine, where you do work in teams, but you work in small hospital teams, so of yourself and the nurse, physiotherapist, occupational therapist, a wide range of healthcare professionals. Whereas in public health, we work with a completely different sectors. So you can work with transport, education, schools. It already depends on what exactly you're targeting or what the project is focusing on. So that's one of my favorite parts of working in public health, because these wider determinants are so broad, the work that public health professionals do also have to involve working with a broad range of sectors. So those are the main differences between clinical medicine and public health. I hope this video has really helped to explain and clarify what public health is. If you have any questions or any comments, please leave them down below and I will answer them as soon as I can. Thank you very much for watching, and I'll see you in my next video.